Hi, everyone. Welcome to ParentingU, a podcast to help you navigate this amazing journey we call parenting. Today, we welcome back Dr. Callie Broussard, pediatric infectious diseases expert with Our Lady of Lourdes Children's Health. I'm your host, Stephanie, and we're glad you're listening to ParentingU. Welcome back, Dr. Broussard.
Thanks for having me. Glad to be back. I think I'm finally figuring out this media recording thing.
You're a pro at it now. You are a pro. And we're recording early in the morning, and last time we talked about caffeine, and I definitely have all of the caffeine this morning.
I haven't hit mine yet, so I might be dragging a little bit.
That's okay. We'll talk about fun things, hopefully, about summer, because we are focusing our season on summer safety and all the things that we want to do to keep our kids happy, healthy, and safe this summer. And so today we want to talk with you kind of about minor injuries, bug bites, first aid, kind of the general things that happen all the time for kids and adults alike, and how we can be prepared, and then how we can be at the ready for if anything does happen. So why don't you start telling us a little bit about yourself again in case someone is meeting you for the first time?
I'm Callie Broussard. I'm a pediatric infectious diseases specialist here. I work at the clinic in Maurice, Louisiana, in Vermilion Parish. I was born and raised here in Louisiana, so I'm no stranger to the bug bites and things of summer in Louisiana. I had been away for my training, but happy to be back working here and serving the kids in South Louisiana.
And last time we talked, you had little babies, and you have two kids. How old are they now?
I have a 3.5-year-old son who is an absolute spitball. He is just all over the place, is enjoying being outside, has to dig in the dirt all the time. And then I've got an almost 2-year-old daughter who is about as rough and tumble as he is. They spend a whole lot of time outside, and just this last weekend he fell about 3 times, got a couple scrapes, needed, of course, Band-Aids to fix it all. And then she likes the Band-Aids too.
Oh, yeah. Once one of them has it, the other one has to have it.
Yeah.
For sure.
Band-Aids and a popsicle seem to fix everything.
There's your medical training right there. Band-Aids and popsicle. That's all you need. Well, that's a great segue into kind of our first question as we talk about common summer injuries. So as a pediatrician, what are the common things you see either outside of the office with your own kids or in the office?
The most common things we're going to see, insect bites and small scrapes. Just being in South Louisiana or Louisiana in general, our climate precludes us to many insects as well as ticks. So they will definitely come in with lots of insect bites, and they may be itchy, and sometimes parents are wondering if they're infected. So the best way to prevent an insect bite is to not get it, right? So how do you not get it? Well, DEET-containing bug spray or bug spray that has permethrin or permethrin treated clothing to prevent insect bites. There are other kind of insect sprays, lemongrass and citronella and all those things. They don't work very well, and in terms of the infections that mosquitoes and ticks carry, those more natural repellents are insufficient to protect you against those infections.
How can a parent tell the difference between a regular bug bite, an allergic reaction, or an infected bug bite?
Day one that it happens, that's just going to be your run-of-the-mill bug bite. It's not going to be infected yet. It's pretty unlikely it'll be infected. Young children, so toddlers, tend to have like a hyper response to mosquito bites. Even if they're not infected, you're going to be like, whoa, that's a huge bump, and it's so itchy, and it is pretty warm, but more than likely it's just their body kind of overreacting to the insect bite. So you can treat that with over-the-counter hydrocortisone ointment to help with the itching. You can put a cool compress on it to kind of relieve some of the discomfort that they're having. How do you know it's an allergy? Well, it's probably going to spread more than just that local reaction. It's not just on their arm or their leg. If they start having coughing, wheezing, trouble breathing with it, that's an allergy, and that's something that we're giving Benadryl for and heading to the ER if we're having trouble breathing.
What about infection? How would we know if a bug bite is infected?
It's going to be something that's probably going to come a couple days later, probably after they've scratched it or itched at it and they've caused some more breaks in the skin. It's going to be red, raised, painful. There may be some associated fever with it, but unlikely. Most skin infections usually are pretty localized. But the best thing to do if you think it's infected is definitely to seek medical care. You need a provider to be able to tell you, yeah, it's infected. We need some topical and plus or minus some oral antibiotics.
And would you say there are bug bites that are more concerning than others? I'm thinking mosquito versus a spider bite, a bee sting, fire ants. You mentioned ticks. I know they don't necessarily bite, but they're a nuisance as well. What's kind of the range there?
It really depends on the person. I mean, a person who has absolutely no allergies, any bite could be absolutely fine. A person who has an allergy to an ant and they get bit, that's a life-threatening reaction. So it really depends. For the most part, mosquitoes, ant bites, even bee stings, they can just be managed with local wound care, cleaning the wound with soap and water, hydrocortisone ointment if it's itchy, and try to avoid scratching. Spider bites, it depends on the kind of spider. So in general, in America, in Louisiana, there's really only two kinds of venomous spiders that we're likely to encounter. And so that's going to be the black widow and the brown recluse. And so if you do have a spider bite, it's going to be important to know what the spider looked like. Most of the time when people think they have a spider bite, they don't actually have a spider bite. They just notice they have some red raised swelling that's painful on an extremity, on an arm or leg, and then they say, oh, I think it was a spider bite. Most of the time, that's actually just a skin and soft tissue infection, and there probably wasn't a spider at all. The only way to know it's truly a spider bite is if you saw the spider bite you.
Oh.
So truly unlikely. Haven't seen all that many spider bites in medical care. A lot of times it's actually just a skin and soft tissue infection. A brown recluse bite, like the name suggests, it's a brown spider. It likes to live in dark areas. It will cause local destruction of the skin and soft tissues, so it can kind of cause some necrosis or the tissue to kind of die away in that area. And then black widow spiders, we all know, have like the hourglass shaped red on their back. Those will cause more what's called systemic symptoms. So patients after a black widow bite will have some abdominal pain. They may have some lab abnormalities. They have actually kind of some severe abdominal pain, and they can get some vomiting and other side effects. So definitely if you see one of these spiders bite you, seek medical care. But I'll be honest, there's not a whole lot of spider bites that actually occur. Like I said, it's usually a skin and soft tissue infection.
I don't know if that makes me feel better or worse. Better. Better. That's just, ugh, that's my worst fear. Ugh.
Well, for spiders, like if it is really a spider bite, there's not really a good medicine or treatment. So I guess I'd rather it not be an actual spider bite because I've got antibiotic for skin and soft tissue infections.
There you go.
Excellence in care. It's what drives us. At Franciscan Missionaries of Our Lady Health System, we've built our team with one goal: delivering exceptional care for every patient at every stage of life. From everyday checkups to complex conditions, our skilled doctors, nurses, and specialists are committed to excellence, and it shows in the honors and awards we've earned across the region. The care you and your family deserve is closer than you think. Visit fmolhs.org/excellence to learn more.
Other things that I could kind of mention, tick bites. So ticks in Louisiana can carry things like tularemia, Ehrlichia. There's not really any Lyme disease transmitted in Louisiana. The only Lyme disease that is here is usually from patients who have traveled to Lyme endemic areas. So Lyme is not something we actually have to worry about, but tularemia is quite a severe infection. So there are other things that we should be watching out for. So again, preventing tick bites. So that's going to be with permethrin treated clothing, DEET containing bug spray, wearing long clothing when you're outdoors, and light colored clothing so that you can see if there's a tick on you. And then after you've come back from a wooded area, do a tick check. And then if you do find a tick on you, you can actually collect the tick, put it in a bag, and then ask your provider, hey, is there anything special I need to do? Sometimes those tick bites can cause just kind of like a local reaction, or sometimes, like any bite, can get infected with a skin and soft tissue infection. But really, depending on the kind of tick that has bitten you and how long it's been on there, kind of will determine what infection you can get. And then for mosquitoes, Louisiana, we are super lucky with all the bugs that we have, and that mosquitoes here transmit West Nile virus. And West Nile virus, we always think about it in horses and things like that, but it truly does cause human disease. So it can cause what's called neuroinvasive disease. So it can cause brain infection in humans. there are cases of this every single year throughout Louisiana, and you can actually look on the state website about cases in your parish and see how many have been in your parish. So it's not a myth. It really does happen. So definitely you want to be protected against mosquito bites. And not only do they transmit West Nile virus, but also dengue fever, which most of us have probably never heard of because that's a disease usually from the tropics, but it has been seen in Louisiana. And I actually saw a case of it last summer in a patient. So that was quite shocking, having not expected it in Louisiana to have seen it.
What about Zika? I was pregnant during the kind of the Zika outbreak, so that's burned in my brain. But that was something that's been in the news recently. What about that?
Yeah, it is transmissible. We do have it here in Louisiana. The number of cases is very, very low, but it will cause kind of some myalgias or muscle aches. It can cause some fevers, some funky rashes. But the biggest concern is if a pregnant mom gets Zika, what's it going to do to her unborn baby? And so it can lead to microcephaly or small head size, and then usually microcephaly leads to some developmental delays. So again, prevention is better than an ounce of cure. So insect sprays and avoiding bug bites if you can.
What do you say to those who may be wary of those insect repellents? You hear a lot of pushback on using chemicals. You mentioned DEET. How can you reassure people that that is the best way to prevent and you're not harming yourself additionally in the process of using those?
That's a great question. So you should only wear it as long as you need to. So if you're going outside, you spray it on before you go outside. And then when you come back in, you wash it off. And so the chance that you're going to absorb it through your skin, or in the case of young children, the chance that they're going to put it in their mouth, well, if you washed it off, there's not a chance that that's going to happen. So yeah, you don't want to wear it any longer than you have to, but these chemicals work, and they're studied to work better than those natural repellents. So if you're truly fearful of the diseases, you should be more fearful of the diseases and infections you can get from these insects and what we call vectors than you should be of the very minuscule risk of these chemicals that have been studied. And if you use them properly, the risk to the human is minuscule.
That's good to know. Well, and are there any other home remedies you'd like to debunk when it comes to caring for bug bites or scrapes? I remember vividly in elementary school getting a bee sting and the secretary taking apart a cigarette and putting the tobacco on the sting under the Band-Aid. I've just never heard anybody else do that. So, I mean, it helped, but maybe it was psychosomatic, but
I've heard of that. I've heard of the tobacco thing. I think there is something within the cigarette material that actually is kind of anesthetic. Like it does provide a mild numbing property. I'll be honest, when my parents did that same thing for me, they actually spit on the tobacco and then put it on the bee sting. So
she may have done that as well. I may have blocked that part out.
Yeah, I definitely advise against that because there's a lot of bacteria in your mouth. You don't know what someone else could have, what you could be catching from their saliva. So yeah, it's probably just not a good practice. There are other things to do to treat a bee sting that are pretty easy to get. I mean, we're all within a couple miles of a Dollar General. I mean, goodness gracious, they're everywhere. So you can get some hydrocortisone ointment. You can get some anti-itch ointment and clean those pretty well first and then apply, relief cream.
Well, can you walk us through some of the best ways to clean and care for maybe some minor cuts and scrapes? You've heard Neosporin, you've heard kind of Bactine. Like, what are the things like my kid falls, riding their bike? What do I do?
It's all going to depend on the degree of the injury, but definitely the best thing you can do, and as soon as you can do it, clean the area with soap and water. Just good old, whatever soap you've got, as long as you've got it, using that soap and water, scrubbing the area gently, and then rinsing it good with water. You don't always have to put an antibacterial ointment on after the injury. That's not usually going to provide a whole lot of protection. It may just kind of keep the wound covered and keep it soft so that it heals and doesn't scab over, but those don't necessarily prevent the infection. The thing that makes the biggest difference when they do the studies is really just cleaning the wound with soap and water. There is always a risk that wounds can get infected, and then the infection that we all fear and it's in the back of our minds is tetanus, actually. We forget that that's an infection. Tetanus is a bacteria that lives ubiquitously, so means everywhere in the environment, in soil, on objects, that when you get a cut or a scratch, a puncture wound, that bacteria can enter that wound and can then release a toxin and give you the effect of tetanus or lockjaw. And so how do you prevent that? Well, one, wash the wound, but two, vaccines. We have a vaccine against tetanus. And so being up to date with your tetanus vaccines is pretty important in terms of those small injuries or cuts and puncture wounds that are going to happen in the summer.
So is it a myth that you can only get tetanus if you get cut on a rusty nail?
No, the risk is higher to get tetanus from a dirty object, from a dirty wound, but you can get it from anywhere. It is, like I said, they use the term ubiquitous when we're talking about the tetanus bacteria. It is everywhere. It really is. The risk is obviously higher outdoors and with dirt.
But it doesn't necessarily have to be something you cut. If you cut yourself on metal, that's not the only place you can get tetanus. You can get it anywhere.
Correct, not just metal.
Well, we talked about insect repellent. We talked about hydrocortisone cream. We talked about a little bit of antibacterial. What else may a parent want to put in their summer first aid kit?
Benadryl or cetirizine, so diphenhydramine being Benadryl, the brand name, is if it's super itchy, in your child's dose of diphenhydramine, you can offer them a dose of that. Cetirizine or Zyrtec or Claritin, loratadine, those can work for good like summer allergies. They work a little bit for itching. They work more for allergens and pollen and things outdoors. But in the first aid kit, really, I'd keep diphenhydramine. I'd keep something that you can wash the wound with. So they have little bottles of saline that have like a squeeze top on them that you can get at the pharmacy area. Having some gauze would be helpful. Band-Aids, of course, though, like we said earlier, Band-Aids and a popsicle fix almost everything.
Why are Band-Aids so magical for kids?
Because they come in so many characters. It's crazy how a Band-Aid and a kiss, often fix it. And I'm like, really? You just fell off your bike. How did that fix it? But I don't know. We got to get some stock in adhesive bandages.
That's right. That's right. Well, and that kind of leads to my next question is, when should we cover a wound, like a scrape, or when should we leave it open to heal? Like sometimes you hear, air, you need the airflow. Sometimes you want to cover it from other dirt. When should we cover and when should we leave uncovered?
I think in general, if it is bleeding or oozing, it's good to kind of keep it covered, but the covering that you put on it doesn't need to be airtight. It just needs to be enough so that, they're not going to be oozing all over everything around them. And in general, it probably is good to just always keep it covered so that other dirt and things is not getting in it, especially if you've got a little kid who's going right back into playing. You're going to uncover it for bath time when you wash it, and then it's okay. I would let it air dry for a little bit after the bath. Then I'd probably put a Band-Aid back on it just so that, again, it's not sticking to other things when it starts to heal. Most of the time when you are going to cover it, you're not going to put an occlusive dressing or an airtight dressing, and there is always going to be a little bit of airflow, which is good because you don't want the water to be sitting on it. You don't want a lot of moisture to sit on those wounds because it's actually going to make the skin more friable or more easy to break, and so it won't heal as well if you keep it completely covered.
What one piece of advice you'd love every parent to know going into the summer about bites, scrapes, and stings?
They're going to happen. Best thing you can do for them is keep them clean, wash them with soap and water, and then Band-Aid and a popsicle fix everything.
Or maybe just a popsicle for the parent as well, right? Not just the kid.
Oh, yeah. That's my favorite thing. When my kid asks for a popsicle, I'm like, yes, we all get one.
Yes, one for everyone. Well, this is our summer safety season, so we're asking all of our guests, what is your favorite thing about summer?
I like going to the beach, but specifically when I'm at the beach, I really like digging holes.
Okay.
I really like digging in the sand, and that's probably where my son gets it from. That's why we have a sandbox at our house, and he's constantly digging in it, and there's sand like in every part of our yard. I just really enjoy digging holes.
That's awesome. Do you ever bury anyone in those holes?
Legally, I can't answer that. No, I'm just kidding.
I cannot confirm nor deny.
I really don't get any satisfaction from burying things. I only like to dig things up. Perhaps in a past life I was a dog or something. I don't know.
Well, I think you're a curious scientific person, so that's probably you're trying to see what's there.
Yeah.
Well, is there anything else you'd like to share, talk about?
I think we talked a lot about summer skin issues that are going to happen. I'm sure someone else is going to talk about water safety, but that's one of my big fears with summertime approaching is water safety in children. So you always want to be within arm's reach around children. If you've got a pool, make sure it's gated. Don't depend on their, little bit of swimming lessons to save them. You always want to be within arm's reach. So that's the last little thing for summer and safety.
Well, thank you again for your time, Dr. Broussard. We'll have everything you mentioned linked in the show notes. Thanks for listening, and we'll be back soon with another episode of ParentingU as we continue to navigate this amazing journey we call parenting together. See you soon.